Good afternoon, and welcome to the Carisk Partner webinar. We will be reviewing our Intelligent Clearinghouse solution today, as well as some legislative updates. This morning's agenda includes an introduction of the team, the Intelligent Clearinghouse capabilities, some state-level legislative updates, followed up by questions and answers. Some logistics for today. Please submit any questions that you have to the GoToMeeting chat feature. All questions will be answered at the end of the presentation. Please mute your phone to limit distractions during the presentation, and the slides for this presentation will be emailed to all attendees at the completion of the webinar. Today, for the Carisk Partners team, we have Joseph Berardo, who's our CEO, and Joe will be covering an overview of the organization and the platform. Additionally, we have Dr. Bill DeGasperis, who is the President of Specialty Services here, as well as the founder of the Intelligent Clearinghouse platform. And my name is Sally Balioni. I am the Sales Manager for the Carisk Intelligent Clearinghouse team. With that, I'll transfer this over to Joe to set up our platform overview.
Thanks, Sally. Hi, everybody. My name is Joe Berardo. I'm the CEO of Carisk. I've been part of the business since its inception as the Carisk umbrella, which is about 2.5 years ago. Carisk is very much involved in both the workers' comp and auto injury marketplaces, and we do that through a number of things. In addition to the clearinghouse, and I'd just like to mention them briefly for a moment because I think it creates an interesting backdrop as to why we're in the clearinghouse business. If you look at the left side of this slide, you will see that we have a number of clinical solutions that we bring to our customers in the marketplace. And essentially, if you look at what we do for many of these clients, is we pretty much deal with their most difficult populations, their difficult cases, and their most difficult patients. A lot of it having to do with injury, a lot of it's grounded in things that start or perhaps have developed a behavioral health component or a substance use disorder component. And in many cases, it's related to people that have some level of delayed recovery. In other words, they had an injury that should have been resolved over a period of months, and perhaps they are still lingering out there, not fully recovered after a number of years. So we're asked to kind of bring clinical solutions, and we kind of bring a whole biopsychosocial approach where we integrate both the psychological, the biological, as well as their social setting into a treatment plan that usually develops. The clearinghouse has become more and more important because in addition to it being kind of an efficiency tool for both providers and for the payers, and connectivity that brings them both together. It does so in a very efficient way where it brings all of the attachments, and we'll talk more about that are required to go along with claims to make them a clean claim and accepted by the carriers from the providers. But what it also does, it gives an opportunity with the advancements of things like artificial intelligence and machine learning. It allows for the payer side of this transaction to begin to be a little bit more proactive as it relates to managing the injured worker or the injury that's related to the auto a little sooner if it's looking to potentially take a wrong turn. And what I mean by that is that our technology is beginning to allow these financial stakeholders to take a look at patterns of claims and figure out who might be potentially exposed to an adverse result given the number of claims over what period of time in combination with diagnoses versus kind of staying on the right recovery path. So again, in addition to this being a very efficient tool as it relates to the claims data exchange, there's a lot of developments happening on the backside of this that are really leading edge that will allow for a much more efficient marketplace. The other businesses we won't touch on today, but again, they're all focused on both the comp and auto space. So we have kind of a deep connection to both the payer and the provider side of this market. And with that, I'll hand it back over to Sally and Bill.
Thank you, Joe. We're going to jump into the Intelligent Clearinghouse capabilities, but before that we do that, I want to give you just a little bit of background. The Clearinghouse was founded in 2000 by Dr. Bill DeGasperis because there was an understanding of a need for an electronic data interface with the payers. We have integrated an end-to-end solution for payers, so from service provider to payment, the provider can see a well-rounded solution here with Carisk Intelligent Clearinghouse. We specialize in the workers' comp and auto space because, as many of you know, there are other solutions for group health and not many solutions that can provide for the attachment of the supporting medical records with the bill in an electronic process to feed directly to the payer. And this helps for processing of efficiencies and payments to get back to the providers more quickly. As you may know, 95% of all health insurance bills are transmitted electronically today. Conversely, only 10 to 15% of the workers' comp and the auto bills are transmitted that way. So obviously this category a little slow to get to the game, and frankly, the fact that providers use the same system to produce those bills and the supporting medical records allows us to get into the space and provide an electronic solution to the providers that need it. Very interestingly, for the people who are utilizing Carisk Intelligent Clearinghouse, we see a dramatic uptick in first-time submission rates. Up to 95% of all bills processed are done so on the first-time submission, which is a dramatic increase from the manual process that can be as low as 65 to 70%. And we see 33% of all claims are processed without manual intervention. And for the providers out there who know what work it takes to make calls to carriers, this is a big win in terms of the process. Overall, we see with the clearinghouse technology, faster processing, greater accuracy, and increased cash flow for the providers who use this system. We give claim verification within 24 hours of the bill submission. That reduces administrative costs through increased productivity and fewer calls made to the payers by the providers. That faster processing turns around to faster payment with electronic submission. And as Joe mentioned, we do provide some business intelligence that will allow for improved efficiencies over time. And as always, we do not charge any implementation fees, and ours is a service that is based on your volume and your usage. To talk a little bit more about the tech-enabled process, as you know, with group health, there is no supporting documentation necessity, and in workers' comp and no-fault auto there is. So our technology allows for those documents to ride with the bill, a much different process than the manual process today. Even if your clearinghouse will allow for an electronic process for the bill, they are still dropping your records to paper and mailing them, and that is not as efficient as it could or should be. We also provide a benefits and eligibility feed from the payers so that you will have that information within the system on each patient record for your reference and use. We have a dedicated IT team delivering seamless integration from the practice management and EHR systems that you are using today. And the big win on the electronic side is the tech-enabled form allows for 50 lines of service code versus the 6 lines on the paper bill. So you can get a lot more done for your buck electronically than you can in the paper world. And as always, we are HIPAA compliant, and we meet every mandatory state level requirements, and Bill will get into that a little later. There are a lot of different requirements via each state, and we are a national platform, so we are involved across the country. And as I mentioned, we are a trusted and established system for almost 20 years. As we get into the simplified administrative process, you'll see that submitters, and that can include an individual provider, a large group practice, a billing company, as well as a hospital system, will provide us their electronic file via a number of different formats, and it really depends on your practice management platform. We are connected to and can connect to every system in the country, and we have these established connections already built. Once those file formats are created, we actually ingest the EDI with the supporting documentation, and the clearinghouse goes through a number of validations, and those validations are built based on the carrier or payer requirement and the state level requirement, so that we understand everything that is necessary to ensure that the bill is 100% clean and correct for a successful first-time submission acceptance. Once that process is done within the clearinghouse, then again, the files are submitted back to the payer or the carrier via an electronic data interface, much like the information came in, and that is where the payer then can review the information for its correctness and for it being clean, and process it through for quick and timely payment. Here's another view of how the process works. As a provider enters their information into their practice management or EHR system, that is the same data that we extract. Once the data, as I said, is extracted, it is validated and edited by Carisk Intelligent Clearinghouse and is provided to the payer via an SFTP. Once the payer accepts the bill, and the clearinghouse will provide you with an electronic acceptance that is date and time stamped for proof of processing, then the payer goes about their process to push the bill through and adjudicate the bill, resulting in a EOB and or ERA back to the clearinghouse, as well as a check or an EFT payment to a provider. And I have an interesting story from a company that we just got signed up in the last 30 days who told me they provided services on the 12th, submitted their bill through to the clearinghouse that same day, and got their EFT back on the 13th. And that's a phenomenal story in terms of processing and turnaround time, but we see that turnaround time really being reduced dramatically through the electronic data interface and providing all of our clients a quicker payment process than they are currently seeing on the manual side. The solution is very easy to establish and implement. As I mentioned, we have established connections with many of the practice management systems out in the marketplace, and it's 4 easy steps to get you enrolled. We need to do a sign up with you through our website, and that takes a few quick steps. Once that's done, we can establish the electronic data interface connection, whether it's through an established interface that we have with your software vendor or one that we would work to establish with them. Once that's done, we pull a test file to complete a data exchange and ensure that the file build is correct. And once that file is tested and approved, then you can go live. This process is a quick and seamless process and shouldn't take more than a week or so, depending on your team's availability and our implementation team's schedule. After we go through the legislative updates, we'll give you some more information about a demonstration, but you can go to our website at any time and sign up for a demo, or you can call us directly, and again, that information will be submitted to you so that you could see a customized data as it relates to your software platforms and how they integrate with our platform. With that, I'm going to turn it over to Bill to give us the legislative update.
Thanks, Sally. My name is Dr. Bill DeGasperis, and to give you a little background on legislation, in the healthcare world, with the 95% of all bills going electronically, that's been going on for over 30 years. And quite frankly, the principal reason is because in the healthcare world, as Sally said, there's no supporting document required. In the workers' comp and auto world, most of these carriers want a supporting document to be able to validate the bill and in fact pay it. So there's a big difference, obviously, between health and work and the workers' comp and auto. Regarding the legislation, there are states that have mandated this, states such as Minnesota, Texas, California. However, they were really breaking new ground, and they created a number of exemptions that really allow providers not to have to submit electronically. And that's been frustrating for the carriers because they want to get as many bills as possible electronically. So I'm going to go over 3 states now that are mandating as we speak, and they've taken the information from the other states to make their mandates a lot better. So we're going to start with Virginia. So basically, all of the states are very, very similar. So in Virginia, as of December 31st, providers were allowed to voluntarily submit their bills electronically, okay? But on July 1st, 2019, it's going to be mandatory. So this is the voluntary period. July 1st, 2019 will be mandatory. The good news in Virginia is the incentive is if a provider submits electronically, they will get paid electronically through EFT. So the entire process is sped up. Now, why do I say if a provider submits electronically? Because we're going to have exceptions, and I'm going to show you those in Virginia. So basically, this act does not apply for a provider who has 15 or fewer full-time employees. It doesn't mean a provider can't submit if they have 15 or fewer employees. It just means they don't have to. The next exception is if they submit less than 20 bills a month or 250 bills a year. Again, that's a small number of bills, okay? So basically, an insurance carrier that doesn't receive more than 250 bills doesn't have to accept them. But the point is, everyone understands the value of submitting electronically because of the faster payment, okay? All right, I'm going to go into New Jersey right now. So in New Jersey, this is a mandate that's coming into effect for automobile bills on September 1 and for workers' compensation bills on November 1. And what's going to happen here is this. Every carrier, third-party administrator that is able to receive bills right now on paper must receive the bills electronically, okay? Every provider that submits more than a certain number of bills, I'll go into the exceptions, must submit electronically, okay? So here's the situation in New Jersey, all right? And again, it's similar to exactly what Sally went over. The first responsibility, once the bill is submitted to the clearinghouse, is to validate the bill for completion prior to transmission to the payer. Is the bill missing a date of service? Is it missing a date of loss? Is the date of service prior to the date of loss? If those values are showing up, that bill is going to be flagged and submitted back to the provider. Once that validation and those values are accepted, the bill will then be transmitted on to the insurance carrier with the medical reports. The law requires that the bill have a medical report. The law also requires that once the bill and medical report make it to the carrier and it's complete, that the carrier provide an acceptance. That's critical. Without the acceptance, we don't know when the clock is ticking. With the acceptance, we know exactly when the clock is ticking. And that's important for prompt payment laws. Regarding exemptions for New Jersey, it was quite simply. In Virginia, it was 20 bills. In New Jersey, it was 25 bills or less. So, for example, there are doctors that probably won't see workers' compensation, such as internists and ophthalmologists and so on and so forth. If a provider furnishes services outside of the United States, they weren't concerned about that. If a provider experiences a disruption of electricity and communication connections that are beyond its control, I actually call that the Sandy effect. Okay, it's as simple as that. We know what that's like. Or if a provider demonstrates that a specific and unusual circumstances exist that precludes the submission of electronic bills, and there are circumstances like that, God forbid a provider's office burned down, or maybe a provider switching medical billing systems and there's a delay, they won't be penalized for that, okay? But it's important to understand that these are minimal exemptions, and the carriers are committed to making this happen. Okay, we'll switch to New York. So in New York, New York had a series of very unique bills that have been in existence for years. New York has decided to follow the other 49 states and adopt the HICVA or CMS 1500, which is occurring at this particular point in 2019. And really what happens in New York is in 2019, the 1500 will get accepted. And then at a certain point, the clearinghouse will be responsible for transmitting the bill to the insurance carrier. And then when it receives the acceptance from the insurance carrier, transmitting that acceptance and bill to the Workers' Compensation Board, because New York has a unique law that requires the double submission. Once the insurance carrier pays the bill, the insurance carrier will be responsible for transmitting the EOB back to the clearinghouse, who will then transmit the EOB to the provider and to the Workers' Compensation Board. And again, it's closing the loop on all of the requirements in New York and keeping the Workers' Compensation Board in the loop. And ultimately, in 2020, it will be mandated that these bills go electronically. Will there be exemptions? There may be some. They haven't discussed any exemptions at this particular point. But that's really the legislation. An important part is what's happening here is the insurance carriers would basically implement state by state by state, and they wouldn't allow bills to be coming in from other states. Because of the increased number of states that are now implementing and are now requiring it, the insurance carriers themselves are starting to say they're going to accept these bills electronically nationally. So we're going to start to see the mandates drop off, and we're going to start to see that these carriers open up because they will find and see the efficiencies in the electronic billing process. All right, I'm going to turn it back over to Sally.
A couple of quick points as it relates to the electronic payer list. If anyone is interested, we can direct you to our website. There is access to the electronic payer list on the website, and we are connected to every payer nationally who can accept electronic submission. And that website, that spreadsheet is broken down by state, so you can, research your individual state. We also have legislative updates on our website if you're interested to see what's happening specifically in your state, and you can certainly reach out to us moving forward for any of that updated information. As Bill said, there are some of the largest carriers now based on this legislation in the Northeast who are preparing for electronic submission, and we will be updating the website to show who those carriers are as their interface is built and completed. If there are no questions, certainly anyone can reach out to me. My contact information will be included in the webinar presentation information that we send back to you. And again, you can reference our website for any additional information.
So I see that the question came in specifically, what would happen if the provider doesn't comply? So truthfully, what happens in Medicare is there's no payment. And that's also what potentially can happen if a provider doesn't comply. The carrier can submit the paper bill back to the provider and tell the provider they're out of compliance and that they have to submit the bill electronically. And that's actually probably the worst penalty that could happen to a provider. And as we know, insurance carriers often sometimes don't pay providers as timely as they can.
Great question, and that's very important because many of the providers that are our clients today have told us, they see carriers looking for reasons not to pay. So to your point, Bill, that could certainly happen. If there are no other questions, we're going to wrap this session up today. We want to thank everybody for attending, and we will follow up with the presentation information and look forward to talking to you in the future. Thank you again, and have a great day.